Shyam, your wisdom tooth on the lower right side has not completely erupted. Even the direction of its eruption is a little slanted due to a lack of space. Generally, in such conditions, an extraction is performed to remove the impacted tooth.
Dr. Nitin, what is an impacted tooth? I have not heard of it before. Could you please provide me more information on impacted tooth?
Sure, Shyam. Wisdom teeth are the last teeth on both the sides of the upper and lower jaws, more appropriately called the third molars. They are the last teeth to erupt into the mouth, usually between the ages of 18 and 24 years. It is common for there to be insufficient space in the jaw to allow the wisdom teeth to take their correct position. As a result, they remain partly or completely below the surface of the gum. Sometimes they may be deeply buried inside the jawbone and are referred to as being an impacted tooth.
Why do they need to be removed?
An impacted tooth can cause a number of problems. The tooth is best removed. In your case, the gums around the tooth have created a pocket or flap that folds food, debris and germs, causing infection and pain. This is called pericoronitis. It is the most common cause of impacted tooth or wisdom tooth removal. The longer we wait, the higher the chances of severe infection. Other causes include decay, pus formation, or abnormal growths.
Doctor, how is the procedure performed?
The removal of impacted wisdom teeth involves a minor surgical operation. A cut is made in the gum over the tooth, and sometimes it is also necessary to remove some bone surrounding the crown to remove the impacted tooth. Rarely, the tooth needs to be cut into 2 or 3 pieces to be removed. Once the wisdom tooth has make the from person to person.
I expect after the procedure?
The 2 common after effects are pain and swelling. It is usual for some pain to be present for the first 2 days, and strong painkillers are provided to ensure comfort during this period. It may also be necessary for you to take a course of antibiotics after the extraction. There will be some noticeable swelling or puffiness of the cheeks that will normally subside by the 5th or 7th day following the procedure. Occasionally, a little bruising with skin discoloration may be present below the jaw. Because the jaw muscles become tight following the surgery, it may be
I take care of the surgical site.
The gauze pad placed over the surgical area should be kept in place for half an hour. In addition, it is important to keep the extraction sites as clean as possible. Gently rinsing with an alcohol-free mouthwash or warm salt water is recommended. However, vigorous mouth rinsing or touching should be avoided. Take the prescribed pain medications as soon as you begin to feel the discomfort. Avoid the use of straws and ensure adequate intake of soft, nutritious diet. Using ice packs on the swollen area can be helpful. Strictly avoid smoking and alcohol intake.
Doctor, how long does it take for complete healing to take place?
Generally, healing of the area depends on how much bone is removed. A tooth inclined forward requires less bone removal and thus faster healing, as in your case.
Is there anything else I must know or keep in mind?
The chance of complications is about 10%. Along with pain and swelling, uncommon side effects include dry socket, excessive bleeding, infection, and bruising of nerves. With appropriate clinical care during the procedure and by adhering properly to the post-operative instructions, all of these can be easily avoided. But do not worry, we will closely monitor you following surgery. Your first follow-up will be 4 to 7 days following surgery to remove the stitches.
Thank you so much, Doctor. Please tell me when I can come in for the procedure.
It is common for there to be insufficient space for wisdom teeth in the jaws. Wisdom teeth remain partly or completely below the surface of the gums. These are called impacted teeth and cause pain. The removal of impacted wisdom teeth involves a minor surgical operation under the influence of anesthesia. The two common after effects are pain and swelling, which can both be appropriately managed. Following post-operative instructions can help speed up the healing process. It is important to revisit the clinic for removal of stitches and for follow-up appointments.